That is why doctors with Baylor College of Medicine have been handing out thousands of masks to folks in Houston. Joining me now is Dr. Cedric Dark. He's an emergency physician at Baylor College of Medicine and an assistant professor there. It's great to have you with us this morning. So you had this stockpile of masks on hand, as I understand it, that had been sent to the hospital. What made you decide that you should start handing them out to passersby?
Well, thanks for having me on, Erika. First of all, I wanted to thank the Texas College of Emergency Physicians for actually donating these masks to our department, to our staff. And one of the things that we wanted to do was actually distribute them out to members of our community, because if we can put a mask, and specifically N95 mask, in people's hands, which is the most effective type of protection that they can have, we can hopefully prevent them from catching COVID and prevent them from coming to the ER in the first place.
What's the reaction when you hand them out?
People were really overjoyed and thankful to be able to receive these. A lot of people have, been using either cloth masks or gaiters, sometimes surgical masks, and to be able to upgrade your mask, especially in light of the increased contagiousness of Omicron, people were really happy to be able to receive them.
There have been questions from the beginning, really, since the start of the pandemic, about what impact it may have had if masks were sent out, as we know, to every household in the U.S. Passing them out like this, do you think that helps to start to hopefully make the mask a little bit less political, especially in your state?
I really would hope so. I think that, one of the easiest things that you can do as an individual and as a family to protect yourself and your loved ones is to wear a mask. This is, of course, in addition to all the other mitigation methods out there, such as getting your vaccination, getting your boosters, and even simple things like deciding to stay home sometimes. Right now, as cases are spiking, you may want to reconsider whether or not you want to go out to a restaurant or out to a movie or other public places. And, if your state isn't going to allow masking in public spaces, at least you have the choice and the option to do that for yourself, because we know that masks will save lives by reducing the spread of this disease.
Yeah, it's a little thing that can have a big impact, as we know. We have been talking so much over the last nearly 2 years now, right? So much with health experts and doctors and staff in medical facilities like yourself as we've watched this journey. And so I found it really interesting to hear on Twitter, you said, I've never had this many colleagues who told me they're COVID positive at any time like this during the pandemic. The fact that you're seeing so many more infections, including among your colleagues, how are you dealing with that?
Well, actually, I just left shift because of the fact that there are outbreaks occurring. Everyone in our department is actually taking COVID tests this week. I just got my swab, so we'll see whether or not I'm an asymptomatic carrier of the disease or if I'm clear, which, is good to know, because I'll be meeting with family for the holiday. And it's the best thing to be able to do is make sure I'm not symptomatic. And number two, if I'm not, also to make sure that I'm not asymptomatically carrying the disease, if at all possible. But it's actually fairly startling right now that we're seeing this increased number of cases. And it's not just people that are asymptomatic, it's people that have symptoms as well. And fortunately, because a lot of my colleagues are vaccinated, those symptoms are fairly mild. We still know that there is a real terrible risk for people that are unvaccinated in terms of their likelihood of proceeding from being just a case of COVID to someone that has to be hospitalized or wind up in an ICU or dying. And we really don't want to see that. So again, I want to reiterate to everyone that's listening, for you and your family, the best thing you can do is get vaccinated. And then after that, just to have layers of mitigation and to reduce your risk by wearing masks, avoiding crowded places.
We're also hearing how important testing is, right? As we all head into the hospitals, as you pointed out, it will let you know where you stand before meeting with family. But tests are hard to come by across the country. Are you seeing that ease at all where you are in Texas, or is this still a real challenge for average folks to be able to get a test?
It actually still is a pretty challenging. I've spoken to a couple of people that have been looking around for some, and it's very difficult. The test that I have over my shoulder here, I bought several months ago in anticipation of, if I ever came down with something, to be able to test at home and not necessarily have to risk infecting anybody at work or out in the community. But again, and I'm glad to hear that the Biden administration is finally deciding to send these tests out to Americans, but they really ought to also consider sending out high quality N95 masks. The supply chain, as we just heard on the last segment, is in a much better position than it was at the beginning of the pandemic. And so there's no reason that the administration should not be sending out these high quality medical grade masks to every American household.
We'll see if they're listening to you. Dr. Cedric Dark, great to have you with us. Thanks for everything you're doing, and happy holidays.
Thank you, Erika.